Good morning everyone. I am Dr. Meera. Today we will be discussing about urinary tract infection. Urinary tract infection is basically commonly known by the name urine infection or UTI. So basically it is the infection of the passage through which urine flows. Urine production happens in the kidneys and from there it goes to the bladder through the ureter. So bladder is basically the storage organ where the urine is stored. When a person goes to the washroom or toilet to pass urine, then through the bladder, urine comes out through the urethra. So the passages are kidneys where the production is happening, ureter from where from the kidney urine goes to the bladder, from bladder the urine comes out through the urethra. So like in case infection happens in any of these passages, it is basically urinary tract infection. Today, our focus in this chat would be basically on what are the factors which cause urinary tract infection. Do we have any measures through which we can prevent it? And how far has the incidence increased and why has the incidence increased? If we compare it from the past around 10 years back and now, the incidence has increased or the number of cases of urinary tract infection have increased by around 50%. There has been a 50% increase in the number of cases of UTI since the past 10 years. What are the factors which are being responsible in causing the increase? Could be because we are using the washroom because of its unavailability, because we are going to work for studies. So the washroom availability is lesser as compared to before, when females or males used to do more of household or nearby household chores. So now, because of the unavailability of the washroom or the less availability of the washroom, we are using the washroom less frequently. This could be one of the factors. Second factor could be that we are taking less amount of water as compared to before. Third factor could be there's a recent surge in the use of these scented vaginal sprays or spermicidal jellies or unlubricated condoms or diaphragms so as to prevent pregnancy or to like people think that they have to keep the vagina more perfumed, or they use douches that it will help keep the vagina clean, or some sprays people have been using but it is basically detrimental, not being useful. So these are some factors which are being anticipated to cause an increase in the number of UTI cases. Also, like when we have urinary tract infection, we go to the doctor and doctor gives us a schedule of maybe around 5 days or 7 days of medications. Now after using the medications for about 3 days and we start feeling better, and we stop the medication thinking that the urinary tract infection has resolved and now I no more need to take the medication, but that is basically causing the organism to stay in the bladder without causing symptoms like burning or frequently going to the washroom. Those symptoms might not occur and we feel that the infection is cured when it has actually not got cured. And what happens is then the organism becomes resistant to that antibiotic. So one, the infection does not get cured. Secondly, the organism gets resistant to the antibiotic. So next time when the organism grows more and you start getting symptoms like burning urine or going to the washroom too often, having a cloudy urine, or having bleeding in urine. So when these symptoms occur and you go to the doctor again, the doctor needs to give you a higher antibiotic because the previous antibiotic which you did not take the complete course, and so the organism did not die and become resistant to it. So this time you'll need a higher dose of antibiotic and maybe a longer duration of antibiotic. So what needs to be done is that you have to take a complete course and then it needs to be confirmed that the urine infection has been cured. Now what are the preventive measures? One, as I just now told, that yes, The antibiotic course, whatever your doctor is prescribing, you have to take a complete course, and then the doctor needs to confirm that the urinary tract infection has been cured by repeating the test again. One. Second thing is that avoid using any scented sprays, vaginal douches, or unlubricated condoms, diaphragms. These can increase the chances of having a urinary tract infection. Do not use a common bath pool. Prefer using showers or a separate bucket of water to have a bath. Don't use a common bath pool. That could be one factor which can increase the chances of you getting a urinary tract infection. Then next thing which needs to be done is whenever a person has intercourse or sex, at that time, before having intercourse, female needs to clean the area, the vaginal area, the outside perineal area with water, and that wiping before having sex or before or after passing urine or motion should be from front to back. It should not be from back to front. Otherwise, those organisms, those infective organisms which are there in the bowel or in the motion area, it will come into the urethra. It can come into the urethra. So the wiping has to be from front to back. It has to happen. The cleaning has to happen after passing urine, before having intercourse or sex, and also after having intercourse or sex, one should pass urine, so that if there is any organism which has gone through into the urethra, that can be wiped out. And one thing which we need to know and we need to consider is that females are more prone to have urinary tract infection because they have a smaller passage from the bladder to outside. The urethra is smaller in females. So females need to take more care that they did not get the infection. So these are basically some factors: taking more amount of water, using a separate bath pool, going to the washroom often, not waiting too much to go and pass urine. So whenever you have the sensation to pass urine, go and pass urine. Don't wait further. So these are some factors: not using the sprays, not using any vaginal douches, not using these scented, perfumed soaps. So all these factors, unlubricated condoms should not be used, diaphragm should not be used. These factors can help us not getting a urinary tract infection. And as I see in my general OPD, almost around 10% of patients who are coming to me as a gynecologist, 10% of the females who are coming to me usually have a urinary tract infection, and it is almost fivefold higher than what is there. It is there in the males. I hope this talk is going to be useful for you. Thank you very much.